Hello, everyone, and welcome to another episode of Aging in Action. And we are so excited and thrilled to have a really special guest on our show today. Like everyone, to welcome Natalie Philippe. She's a registered nurse and public health nurse with Public Health Sudbury and Districts. Welcome, Natalie.
Thank you very much for having me.
Hi, Natalie.
Thank you so much. Thank you so much for coming on the show to talk with us today. And we're talking about a topic that's very relevant right now. And we're talking about the COVID-19 vaccines. And before we dive into that, how about you briefly introduce yourself to our viewers and talk about, why you do what you do every day?
Wonderful. Sounds good. I'm Natalie. I've been working with public health since April of 2006, so 15 years now. Quite exciting anyways over the years. I usually work in health promotion. And I work in physical activity promotion. And when the pandemic, this happens quite often with public health, is when we have something that happens in our community, a lot of our employees get redeployed to support the efforts and public health action. So hence why we have so many public health nurses that are readily available. So we switch things over. Certainly, we've been switching things over since March of 2020. So it's been a long time. Certainly a huge learning opportunity for me, and getting to know a lot of people that necessarily I wouldn't have come into contact with via computer, of course, but certainly having opportunities like this for sure.
Awesome. Great. So I think let's just dive right in because, time goes by so fast here on Aging in Action.
And it's a hot topic, right, Nikki?
I know. You can tell I'm excited. Can you tell I'm excited? So I hear all these different names. So I know there's multiple vaccines. Can you maybe break it down for us a little bit and tell us, the different types of vaccines that are available?
Mm-hmm. Absolutely. So we have Pfizer and Moderna vaccines. These vaccines are called mRNA vaccines. There's also the AstraZeneca vaccine that is a viral vector-based vaccine, so slightly different. But all of these vaccines, like the mRNA basically sends a message to your body. And so that message tells your body to produce a spike protein that is actually attached to the coronavirus. So that's why it's called a coronavirus, because of the crown that's surrounding it. And that's called the spike protein. So it sends a message to produce, attaches onto the virus itself and bumps it out of your system. Kind of a neat concept. And when it comes to AstraZeneca being a viral vector base, so that is actually a weakened virus, no different than a common cold. There's quite a variety of different viruses. So it's not the COVID-19 virus, but same thing, attaches itself to the spike protein, off it goes. Pretty brilliant science, if you ask me.
So there's 3 different types of vaccines that we have available to
that we have available locally to us. Yes. So there are 4 approved throughout Canada, though.
Perfect.
So I have a question. So if I have my vaccine, but today, where we are today, can somebody call and pick the kind of vaccine that they want?
What I would suggest is to call and pick the clinic that you want, because each clinic has a different vaccine: Pfizer, Moderna, and AstraZeneca. Those are the 3 that are sent to us. On a weekly basis, when we get a shipment, it's the ministry that says, okay, you're getting X amount of Moderna, you're getting X amount of Pfizer, and you're getting X amount of AstraZeneca. And so when we look at that, we usually look at which vaccines you used as your first dose. So if you haven't had your first dose, take the first vaccine that's available to you. If you're in the process of getting your second dose, and let's say that you're waiting for your second dose, and now you're eligible to receive your second dose sooner because you've received it before April 18th, I would recommend, and so we would recommend that you take the same vaccine that you've previously had. If not, it's okay to change because you don't want to wait. So you're like, this is what's available to me, I want that one. And that's okay. The science is there to say it is safe to do so.
Yeah, because for me this morning, I was just telling you, we booked our second, and we had Moderna the first. Now we're getting Pfizer, and I didn't wait. I wanted it booked, so that's what we got because Moderna wasn't available. So I'm fine with that, but I know a lot of people are hesitant about all of it, not just taking a different one for the second dose, but just they're hesitant about taking the vaccine, period.
Mm-hmm. I think one of the hesitancies that I've heard from just different people in the community, and maybe you can touch on this, Natalie, is the vaccine came out really quick. We have quite a few different options, right? I don't want to say came to market quick, because I don't think that's the right terminology, but they came really quick. And usually vaccines sometimes take longer than that, given, the history of vaccines. Can you touch on how maybe Pfizer and Moderna were approved so quickly?
Absolutely. It was kind of, so we were a bit in a rush in a sense, as the pandemic really different than H1N1, different than what we've seen in the past. So in the terms of the process, it was submitted a little bit different than other vaccines. Usually what happens is they're developed in a lab. From there, then it gets evaluated and a full report is sent. What they did is, because of the time pressing, is that they kind of submitted it, instead of submitting an entire book, it was submitted chapter by chapter. So here's chapter 1, here's our evidence, this is what we have. Chapter 2, here we go, 3, 4. And so that was reviewed by there were independent research and reviews. And the great thing about vaccines, this is for all vaccines, that they continue to be monitored and for their safety and effectiveness. So anything that could happen is always reported, continuously looked at from different countries that have been administering the same vaccines as well. So all of this information is gathered by a group. So this is what we call NACI. It's the National Advisory Committee on Immunization. So they review all of this content, continuously monitor this with the support of Health Canada and Public Health Agency of Canada to get that evidence to make sure that they are continuously safe.
Yeah, I do remember after getting my first dose, there was an option to enter into some kind of research study as well, to kind of how do you feel after your vaccine, and kind of monitor. And I thought that was really interesting when it comes to however many people do get vaccines and do end up giving you guys that data as you're monitoring. So that's fantastic. Can you touch a little bit on maybe the vaccine rollout plan? Honestly, I feel like there's lots of changes that kind of happen with it. It's hard for me to keep up. Can you maybe just touch on how that's rolling out so far to date?
Yes. Well, I mean, it's a big plan and big undertaking, of course. It takes a lot of people involved in this entire rollout. So basically, the decisions are really made by the ministry. So the Ministry of Health of Ontario really decides when the vaccines are coming, how many vaccines are purchased for Ontario, the distribution of them throughout the province. It's really these are the individuals that pick all of that. And so they're the ones that will say, okay, so effective on this day, for example, with the 70 to and up. And so in terms of that, we're looking at the ministry will launch a media release, and from there we'll say, okay, so where are we at now? How far are we going? We keep the percentage of how many people said they were interested in the vaccine, how many have had their first doses already, how many are looking at having their second dose. So all those things are really taken into consideration, looking at the different groups. When we first started, we really looked at it from a lens of how equitable can we make it? Because when you go, okay, 80 and up, you're looking at quite a large population. There's people that are 90, 80 in the year, 79. So how do health conditions. So those are all things that, you sit back and you look at it from a different lens. You say, okay, so how do we administer these as equitable as we possibly can through this whole system? So that's why there was a calling system. There was an online booking system. Not everyone is online. Not everyone is comfortable using online. So having those phones. We also have a large geographic area, as do many health units in the north as well. So how do we make sure that everything is equitable from a different community so that everybody's equal, coming to one health unit, one central location? And on top of that, dealing with vaccines that were at the time kept very cold, which they still are. The AstraZeneca is at milder temperatures, but looking at how are we going to store this, all of those items really came to place. And I think over the months, we really have it all under control now. It's kind of spinning as we go. We're like, okay, next, kind of like a little hamster on a wheel. Off we go. But I do hear a lot about our vaccines. So a lot of people will say, it's a little bit challenging getting an appointment. But once you're there, it's amazing how fast and efficient they are. So I'm glad to hear that once you're there ready to receive your vaccine, that so far lots of people are having a really good experience.
I was blown away by how organized, and I've went to both clinics, how organized you guys were when it came to as soon as you get to the clinic and as soon as you're done and you leave the clinic, and how seamless everything was. And I mean, kudos to you guys, all of the people that were involved in organizing these clinics and still organizing these clinics. There's a lot in the background, like you're talking about, the people just don't realize because they're not in it. They're not doing it. So, we just want to say thank you and keep going. You guys are doing awesome. Don't stop when it comes to helping the rest of our community continue to get vaccinated. Now, if you're somebody watching this episode and you're like, I want to book my first dose, what would your recommendation be for them? Who do they reach out to? I know you mentioned clinics. Where do they go to find that information?
Couple of options. There's the online booking system from the ministry, and that could be obtained through our email, our website. So when you go into our website, there's that Ontario booking system there. So that's probably the fastest, because you can sort of do that in your own pajamas. Well, technically you could call someone in your pajamas too, in a sense. But it, any time of the day. And so you just put in your postal code. It'll ask you for your date of birth. So all that information, but again, it is a ministry link and website. So that information belongs to you. No one else will access that. It's all in the ministry database. The other option is the calling in. So we have a 674, I think it's 2299. I've been saying that number so many times. I think I know it by heart. There's also a 1-800 number too. So by calling that, then you speak with someone, but they ask you the same exact questions. We're going to ask for the health card. We're going to ask you about, the different vaccine availability for you too, because it goes by age group. So as you know, we're now immunizing youth 12 and up, and so they only can receive the Pfizer vaccines, the only vaccine that is safe for them. It's 18 and up for Moderna. So looking at the different types of vaccines, we go based on the date of birth. So that's why we need that date as well, so we can identify the vaccine with the person.
Speaking of that, 12 and up, so is there anything in the pipelines for 12 and under?
Well, that comes from the companies that make the vaccine. So they're in that whole process of looking at that. So right now, from what we know, is 12 and up is the safest. From there, then we'll be able to know more information. But from our public health locally, it's 12 and up.
Well, I found booking I've done both, booking online, and I've also, this morning we did by the phone, and the phone turned out to be faster than, because we were at 100 and some thousand ahead. But also if you were wanting to book, like I wanted to book with my husband at around the same time, so we didn't have to make 2 trips. So definitely calling made that easier, because you're talking to a live human being who's looking at both records, which it made it, so we're in minutes between each other. So that was very, very helpful, I thought.
And I'm so used to speaking on behalf of public health, but there are pharmacies as well and healthcare providers, so we can't forget them either.
I was going to ask
very important in this whole process too.
Sure.
Sorry,
I was going to say in our building downstairs, it says you can book your COVID vaccine. So I was going to ask, is that another option? People can actually go directly to that clinic or that pharmacy and get their vaccine. That's good to know. Okay.
Yes, absolutely. And if you've received, so let's say your first dose was the AstraZeneca vaccine. So some pharmacies will also have Pfizer and Moderna at this point too. So depending on their availability there. So I think they also have an online version too, that you can click and explore what they have on their website online or by calling as well.
Okay.
There's a lot of people that had booked their vaccines, and the dates were further because there was like a shortage, I guess, of vaccines available. So people that have appointments that are booked in August, and do you recommend they call and see if they can get their appointments quicker, or will they get a call from the health unit? Like, how does that?
Yeah, so with this group that just happened, we'll take that for an example. So on Friday, so we issued media release to say if you're 70 and up, or if you've received your vaccine prior to April 18th. So that is what we call tranche 1. So the first group of folks that were immunized with their first dose. Because we also have to take into account when you received your dose. So you can't by any means receive Pfizer before 21 days. So that's against the product monograph. It's 28 days for Moderna. And so when you're looking at these vaccines that we have, we're looking at the individuals, we just kind of grouping them is probably best. So right now we're inviting those that would like to increase, so to have it a little bit sooner, to call in. So the endeavor is on your part to do so. Or if you choose a pharmacy as well. So let's say that you have an appointment booked at a mass community clinic in July, but you managed to get one at a pharmacy in June. And so please cancel the July appointment because that opens up a spot for someone else. If you've rebooked with public health into a different clinic, we do that for you automatically in the system. It takes us a few minutes to just click and it's opened up to someone else. Just because all these vials, they come into vials of 6 doses or 10 doses, depending on the vaccine. And so once we open the vial, we withdraw all the vaccines that we need from that vial. We don't want to waste them. So what we do from that point is offer it to someone else that's waiting to either first dose or second dose.
Mm-hmm. Perfect. Yes, I mean, this is really great information to be sharing with the community, and education's power, right? And there is some people that are unsure. They always say, you know, I need to do a little bit more research before I decide to get, you know, vaccinated. Is there any resources, any videos, any educational materials that maybe you would recommend that we could share with our viewers if they want to learn more about these vaccines and getting vaccinated?
Absolutely. You just made me think we have quick fact videos that are up on our website. It's actually yours truly on them. I'm not pushing my...
I remember when we talked about these.
They're just simple, quick, under a minute, depending on the language that you prefer listening to, because I do provide them both in English and in French. And so they're just quick. Oftentimes, it's just something that we feel like, okay, well, maybe we should talk about this today. And so we'll flip it into a quick back video because it's just fast. You just put it in your phone and off you go. Our website has a lot of frequently asked questions. So based on what we think are questions that the general population might have, questions that our staff have, questions that we receive in our call center. So we'll put all those frequently asked questions and the answers is there too. So you can take a look at those, and folks are welcome to call us through as well. And when they call us in our customer service center, we have a few people that are there to, that might take a little bit of time. So it depends on how many questions folks have, because it all goes to these lovely folks. And so sometimes it takes a long time to get a call back. Sometimes it's within, it really all depends on the day and how many callers there are. That one won't tell you if there's a queue. It'll just either you'll wait a little bit or so it depends on what, but lots of information there.
Oh, that's perfect. Definitely. We're going to want to make sure we share Public Health's website. We'll share the link to those quick videos you were talking about, and try to share those as much as we can as well. Want to make sure we share a link for that book, the online booking system you were talking about, and the phone number in case people want to call you guys directly, and kind of keeping an eye on time. Is there any final thoughts you'd like to share before we wrap up the episode today?
I think that's pretty much it. I mean, we have our Twitter and our Facebook account too. If folks want to follow us there because we really put everything there. I usually recommend too our weekly updates. They come up on a weekly basis. And so we give you because a lot of people are interested in what's the percentage, Nat, of people that are immunized, because they're really looking at the reopening Ontario framework. Like, I can't wait. Yep. I don't blame them. So certainly that information is in there on a weekly basis, but daily, every day we update our main coronavirus page, which will give you the number of cases, which we all hope will remain low for the rest of the summer as we administer more vaccines and get more folks immunized as well. And not to be shy, to have conversation about these vaccines as well. And so that's what we're here for, is to talk about their safety and how we wouldn't be administering them if we knew they weren't safe, right? There was a pause for a little bit. So we're, taking it one day at a time, monitoring them, making sure they're safe, and off we go.
So you're not injecting me with a tracking device.
Gwen?
I'm not changing your DNA.
Okay, good. Just checking. Because according to all the internet, and then I think, okay, what about my phone that is already tracking me? So everybody knows where I am, but it's just there's so much myths and misinformation out there, right? So that's why the public health side, I very much believe in science and the scientists and what they've done. And I think, like I was saying earlier, I was born in the 50s, so I was injected with heaven knows what. I don't know, but here I am now in my 60s, still alive. So I trust the science, and I didn't hesitate to sign up to be vaccinated. But, there's a lot of people that are still worried that somebody's doing something terrible to them.
And we were talking about that too, and I gave the example of chickenpox, and you remember chickenpox was something that a lot of children would have, and some would still have scars today from chickenpox, and unfortunately some people lost their lives over chickenpox, and today rare we have cases of chickenpox because of vaccines. At the end of the day, it's the vaccines that have done that. So looking at what vaccines can bring to a community and how important they are in reducing that spread of the virus, and of course the variants that are very concerning at this point. Yeah.
And I think the start is having conversations just like this. Start and have that conversation, feel comfortable asking questions, and do your research. And we'll definitely share as much information as we can to help educate our community as we can. We want to thank you so much, Natalie, for coming on, talking with us today, providing this education. It's so beneficial. Thank you to everyone that's working behind the scenes here to help get our community vaccinated. We appreciate you, and you're all helping us age in action.
That's very kind. Thank you very much.
Thank you so much.
Thanks, Natalie.
Thank you.